Well, it's a good time to have this conversation with Dr. Gagandeep Kang. She's been kind enough to give us time over the last 2 years and speak to us repeatedly over the last two waves of COVID. And from what we understand, we are well and truly in the middle of a third wave. There are several different voices, several decisions that are coming in. People have different points of view on how we should be dealing with Omicron, whether it is dangerous, it's not. Nothing to worry about, things like that. But this is the voice that I really trust among all of those. Dr. Kang is a professor of microbiology at CMC Vellore. She's also actively been part of the planning behind COVID-19's policy work. She worked with WHO's working group on COVID-19 on vaccines as well. She also advised the Indian government last year. So it's an honor to have this conversation with her, and her time is obviously very, very precious during this third wave that we're seeing. Dr. Kang, thank you so much for giving me your time. The WHO has put out statements recently, given the movement of Omicron across the world and the sharp spike in cases. The US reported over 1 million new cases just yesterday. Europe is now in the throes of a wave as well. The WHO is saying this is not to be taken lightly. From an India point of view, do you think that there's a chance we might be taking this lightly?
I think if we look at the work that has been done in India to prepare for a potential third wave, the essential requirements are the same requirements that you have of any health infrastructure. Right? The ability to detect a problem, the ability to be able to manage that problem, both outside the hospital and inside hospitals. We've tended to focus much more on the within hospital scenario. So if you look at the preparation for oxygen beds, the setting up of war rooms, etc., the number of beds does seem to be something that has increased quite rapidly. The quality of the personnel and the quality of the care, and whether those are truly commensurate with what is likely to be required, is rather patchy. Good in cities and not so good in smaller places. When it comes to looking outside of the hospital and how we channel referrals, here is where it becomes quite messy. We already have, for example, in Mumbai, lots of people being put into hospitals when they are well, because they are infected with a virus that either has not been identified to be Omicron or has been certified to be Omicron. They're taking up hospital beds for 5 days or 10 days when they don't need to. What you need is a sensible home isolation protocol for such individuals that is informed by appropriate policy. I hope that we will evolve towards that. It would have been great if we'd done it before the third wave.
There is right now, I mean, there are various decisions being made by various state governments, weekend curfews, night curfews, weddings with 100 people or weddings with 200 people in it. Will any of this work? Because, I mean, at the same time, we have a lot of people turning around and saying, what is a weekend curfew and how does that in any way, break transmissibility of something like COVID?
So I've been making this argument for a long time about curfews with people who make these kinds of policies. And they say, oh, well, the behavior is more risky at night or on weekends, presumably. So there's greater chances of exposure. So my response to that is, show me the data. Show me that having a weekend curfew really does make a difference to transmission. And actually, if you think about it, these are the ideal opportunities to be doing some research and generating the data so that in future, we understand why we are doing what we are doing. Take two districts, put a weekend curfew in one and don't have a weekend curfew in the other. Look at trajectories. See whether it makes a difference or not. Same goes for night curfews. There are lots of opportunities for us to experiment and then have the evidence that drives decision making instead of just arbitrary statements being made by lots of people. 200 people at a wedding versus full cinema hall with 50% seating. These are all actually pretty amenable to experimentation, but it requires careful data collection. And unfortunately, that's the piece we are really bad at. So we'll continue to make arbitrary decisions.
Speaking of data collection, Dr. Kang, we don't know, from my understanding yet, whether we should be mixing and matching our booster doses. We've not really studied the larger population's reaction to vaccinations in India. We only still, even now, have two vaccines to go on. Do you think we could have done more, done better? Or do you think we have enough data right now to go by on this third wave?
Well, recommendations to do mixing and matching studies were made a year ago and were not followed up on. My institution is doing a mixing and matching study, and yesterday we had data from the Asian Institute of Gastroenterology in Hyderabad with a small study that showed that mixing and matching was safe and immunogenic. So, but the important thing to remember is that when you do small studies, the side effects or the safety issues have to be very large for you to be able to measure them, right? And immunogenicity, you take a break and give anybody any vaccine, the antibodies will go up. Will they go up 10% or 200% is the difference that you want to measure. But it's not like a third dose of anything would not be immunogenic. So it would have been nice to have the data. And here we are in a bind where we delayed the generation of the data, and yet in a situation where you need to act quickly absent that data. So what are the choices that we have? We can say with reasonable certainty, and okay, I can caveat that a bit, that both Covishield and Covaxin are reasonably safe. And if you give a third dose of either, you would not expect to see a major increase in side effects. You would expect to see some level of increase in antibodies. So if you have no data, then it's fine to go ahead with any of the vaccines that you have. You can always do another booster with another vaccine once you have actually better data available. So odd situation. And with Covovax and Corbevax, we are now in a situation where we can borrow data from the UK, where at least for Covishield, we know that if we give Covovax, we are likely to have a higher level of antibodies than if we gave a third dose of Covishield. So some patches of data that we can use.
In fact, that's a question that's coming up now, because we know senior citizens with comorbidities are going to be up for their precautionary or booster doses fairly soon, and they're all asking the same question. I had 2 doses of Covishield. Should I take the should I take another Covishield? Should I take a different option? What are the options on the table? Is there likely to be an advisory? Is there likely to be a choice, in your opinion, or are they just going to have to take whatever's available?
I think we have. Given that the 10th of January has been announced as the day that it will start, I'm assuming that by the 10th of January, we will have an advisory. But based on the data that's available from the CowBoost study, I would think that it makes sense to take the Novavax vaccine if you've had 2 doses of Covishield before. And there shouldn't be a problem with taking it after Covaxin either. In the rest of the world, what's been shown is that pretty much there isn't a study that's comparable to Covaxin plus Covovax, but there are studies that are comparable potentially to Covaxin plus Covishield, where you get a boosting of the antibody response. But you have to remember that Covaxin is not exactly the same as the Chinese inactivated vaccines.
Speaking specifically of Omicron and the spike that we're seeing right now, in fact, NDTV has just put out a story a little while ago, saying that Rajasthan has reported its first Omicron-linked death. The story has been, I must tell our audience, attributed to sources from the government. So it's not an official a piece of information yet, but this has come out at NDTV. I want to understand from you, Doc. A lot of people are saying, you know what, it's spreading, but it's not really that dangerous. Maybe we should just carry on with our lives. Maybe, this is how we get herd immunity. What are your concerns with Omicron? Is there a possibility if it runs through the population like this, it might mutate into something more dangerous? What should we be worried about?
Well, the important thing to remember is that people who were vulnerable before are still vulnerable, even with Omicron. The vulnerability might be a little bit less, but it hasn't gone away. So we will have hospitalizations. We will have people who will need ICUs, ventilator support. We will have people who die. The proportions might be, as we've seen in South Africa, as we're seeing now emerging data from the UK, that the proportions are a lot less than we saw with Delta. But that's not to say that they are not there at all. And in India, given our large numbers, if all of the data are accurately reported, we could be talking about very big numbers needing hospitalizations, needing ICU care, and dying. It hopefully will mean that our health systems will not be as overwhelmed as they were with Delta. But if the numbers are 3 or 4 times greater in half the time, then for a short period, we might very well be overwhelmed.
Do you believe, and we learned one hopes we learned some hard lessons during the second wave in terms of our healthcare system and how we needed to prepare, the availability of oxygen, availability of ambulances, oxygenated ambulances. Have we as a country, in your opinion, used the time between the second wave and what is now the third wave adequately to prepare and to make up for what we didn't have when the second wave hit us?
The proof of the pudding is in the eating. So we will find out, but at least in terms of the oxygen, with the setting up of the PSA plants, what we've essentially done is distributed the availability of oxygen. Unlike previously, where the liquid oxygen, was mainly made in the East and then had to travel across the country to get to where it was needed. The advantage of larger storage facilities of PSA plants is that you're not dependent on transport to the same extent. So I hope that we will do better there. In terms of availability of ventilators and ICU beds, I still continue to worry about them because it's not about the equipment. It's about the people who man the equipment. And you don't create a critical care specialist or a critical care nurse overnight.
We are, of course, seeing from our various state governments, different reactions at this point. Mumbai, for example, to yesterday and today talking about a possible lockdown if it hits 20,000 cases per day. At the same time, there are states that are going forward with elections, with very large gatherings of rallies. Again, unfortunately, it seems like we're back to a year ago. But while scientists had last year also recommended that we need to have pocketed, calibrated approaches for different cities and different neighborhoods, do you think the election is going to cost us in terms of the spread of this virus?
I think the situation that we are in today is a bit different from where we were last year. One, we have much of the population vaccinated or vaccinated and infected. So you don't anticipate as much severe disease as you saw previously. The other thing is that we have tools in terms of treatment that we didn't have last year. Molnupiravir might not be brilliant, but it's still something useful that you can give outside of a hospital setting. Fluvoxamine is another drug that can be used. Some people recommend the inhaled steroids. That's in some situations considered a reasonable approach with some evidence behind it. So we do have treatments that are available if people develop disease, and we have protocols that are better informed than the ones we started off with last year. So steroids we knew, but the role of IL-6 and using drugs that target that is pretty well established protocols now. Should we have elections and should we have election rallies is another matter entirely. But in just as a public health principle, any disease is going to spread more easily through the respiratory route where you have more people congregating. So if you are serious about controlling the spread of a respiratory virus, then it makes sense not to have mass gatherings or unnecessary mass gatherings.
We've also decided now to vaccinate our teenagers, 15 to 18. Again, is this a good time to do this? Should we be broadening that group as well, in your opinion, and vaccinating more of our children?
So I understand that the massive increase in teenagers getting vaccinated has also been accompanied by a decrease in second doses for adults. If you ask me to do a trade-off for those two, I'll go with second doses for adults. Teenagers in general who don't have comorbidities, who are relatively healthy, do not need to be at the front of the queue when it comes to vaccination.
But in terms of closing schools, they have exams coming up. This particular group of people between 15 and 18 will have board exams coming up. That whole question comes up again of should they be physically answering their exams or trying to do it online? There is a toss up there on what needs to be done. Do you think that it's okay to send children to school unvaccinated at this point, or should they be kept at home?
I think children should have gone to school for the past year. And I think school really matters for children. The interactions matter. And in India, in cities, we don't see what's happening outside of cities. But kids who are outside cities have lost 2 years of schooling. And that's going to impact the rest of their lives, because we know that education is fundamental to your future employment. We've kept kids out of school and we don't recognize the damage that it has done to them. Now, children mostly can handle the infection well. When it comes to vaccines, I think one of the things that we should, for kids particularly, because this affects the rest of their lives, I think there are two things you need to consider. One is, which is the best vaccine for children? Are we giving it to them or are we using just what's available? Where's the evidence to show that the vaccine that we have chosen is the best vaccine for children in terms of the amount of protection, the number of variants it covers, and the durability of protection? Do we have that information? Did we make that decision based on actual data? And the answer is no. So to me, it makes sense as a scientist to say that this is a situation where we could have generated the data. We still can generate the data. In the meantime, we should be thinking about continuing to send children to school. It's not like no children will be infected, that no children will ever get severe disease. Very, very small proportions of children who are healthy could develop severe disease. But that is a risk, and I would leave it then to parents to decide whether they can afford to protect their child forever or for as long as they can get the best vaccines, if they really want to. For me, my children are older, but would I have sent them to school? Absolutely.
The WHO has said that even if patients recover within 7 days, there ought to be a 14-day quarantine for everyone who tests positive for Omicron. Would you be able to explain to us why that is?
Well, if you look at shedding of any virus, there is a tail, and the tail can vary. Now, do I agree with the WHO on a 14-day quarantine period? I don't. I think 7 days is reasonable because the bulk of people who test positive 7 days after testing positive are extremely unlikely to be continuing to shed the virus. And I think it is, if they are vaccinated, they've gotten Omicron, I really think there's no need for them to isolate for yet another week.
Now, on latest numbers, and these are today's numbers, India has reported, according to the Indian Express, 58,097 new cases of COVID in the last 24 hours, 534 deaths. The number of deaths have spiked. They were about 200 yesterday. They're 534 today. How worrying are these numbers for you right now in terms of the death spike, which we're seeing now today? We've not seen it spike this entire time.
Yeah. You started by saying we were in the middle of the third wave. We are not. We're at the start of the third wave.
Oh dear.
And we are going to see numbers of cases, hospitalizations, and deaths go up beyond this point.
What is your expectation? Because we've had some people say that it's going to possibly peak in February and taper in March. Is that likely?
Anybody who tells you anything with any degree of certainty doesn't know what they're talking about. So I would hold off on making predictions. We can talk about trajectories, and right now the trajectory is one that heads upwards. I also think, based on what we've seen in other parts of the world, that this will be short and sharp, and the sharp will hurt.
Okay. The sharp will hurt in deaths, you mean?
Yes, I think we will have deaths, we will have hospitalizations. Will they rise to the level that we saw during the second wave? I can't really say that. I think we'll need to wait a little more to see how the trajectory of deaths progresses. It could go in either direction. You could argue that we have many, many, many more people being infected every day, and therefore that small proportion will be much higher. My gut tells me that that's not going to be the case, but as I said, I'm not predicting anything, because the one thing that we've learned is that with a new variant, you have to watch and wait and see its behavior over a period of time in multiple locations before we understand what's going to happen. And unlike other variants and other situations, we are now in a situation where you can't directly take lessons from other parts of the world, right? Israel, not a good fit for us. The US, not a good fit for us. In the most hopeful scenario, South Africa is a good fit for us, and we will follow that pattern.
Doc, you also mentioned earlier, you said that there are some drugs available that do well to battle COVID, perhaps outside of hospitals. The other thing we noticed in the second wave, and partially also in the first, was a run on pharmaceuticals, because we ran out, there was some hoarding, there was some black marketing, there were some recommendations and prescriptions of drugs that were not necessary at that point. Are we prepared as a country for the demand that might come based on the numbers you're talking about?
So I think with many of the drugs that were prescribed last time around, some of it was because there was guidance that was put out from official sources that was not accurate, that had not been revised in time to take into account the evidence that had emerged since the time that guidance was formulated. It has now been revised, and the guidance that we have now is reasonable. Unfortunately, what we also have is a private sector, especially the small scale private sector, that seems to focus on the idea that the more drugs you give, the better the doctor you are. And I've seen prescriptions with 15, 20 drugs for people who are actually going to have nothing more than a fever and a cold. So quite frankly, with Omicron, if you have fever and a respiratory infection, take steam inhalations, take paracetamol and wait it out. That's the treatment that 95+% of people are going to need.
What is your advice right now for citizens who are watching? There is this fear of, okay, now let's stay at home, let's not go out. Has the advisory changed from the previous wave, or is it the same?
Well, I would say get on with your life. What are the sensible precautions you can take? So you can wear masks. That's easy if you're going to be meeting people that you don't know. If you're meeting them outside, wear a surgical mask. If you're meeting them inside, wear an N95 mask. And that to me is pretty much it. If you are a person who is generally healthy, no comorbidities, and not over the age of 65. If you do have comorbidities and by the way, everybody get your shots of vaccine. But if you do have comorbidities or if you're older, that's the time to think about, do you need additional protections for such individuals? And here I would say that during the time that cases in your community are higher, be a little extra cautious, cut out the stuff that is unnecessary, and go on with what you think is absolutely essential to your life.
Do you believe that lockdowns work? Because there is a toss-up between the economic cost of a lockdown and the possibility of breaking the chain of transmission.
The time for lockdowns is long past. So I think, with lockdowns, with the testing strategy, I don't know why we are still in a 2020 mindset. It's about time that we revised it in view of the situation in the world today. And lockdowns make absolutely no sense to me when your population is largely vaccinated and you can have sensible guidance that does not result in huge transmission events. You might remember that early on, we were always talking about super spreader events and what was going on and why we needed to shut down mass gatherings. Not hearing so much of that anymore because the virus is really everywhere. So what is a lockdown going to achieve?
Are you concerned about, Are you concerned about the emergence of new variants? France is reporting some sort of variant. Israel is reporting, a combination of the influenza and COVID. All of this sounds scary. It sounds that we might be in an endless loop of COVID variants. What is your expectation?
So these are scariants, as I think, was it Eric Topol? Somebody came up with the term. Every time there's a new mutation, new combination detected, this is going to be the next major threat. But there are no major threats if you don't have the epidemiological data to show you that it is a threat. Just going by sequencing, just going by isolated laboratory reports tells you, watch out and look deeper. It's only when you look deeper that you can figure out whether this is going to be a serious issue or not. And so far, for both Flurona and IHU, I don't think we have that information. Variants will continue to emerge. Most variants, the important thing to remember, have no consequence whatsoever. There is, when you have the virus replicating in a community, there are variants arising all the time. They don't maintain, they don't transmit, they don't survive because they don't confer an advantage to the virus in its ability to transmit or escape the immune response. A few do, and those are the ones that come up as variants of concern.
Doctor, we know that last year the central government put together some advisory groups to advise it on policy, led by scientists. You were on a very prominent group yourself. Are these advisory groups still active now? Is the government seeking your advice when it's deciding its course of strategy during this third wave as well?
Faye, there's a difference between advice and executive function.
Okay.
So plenty of advisory groups, I'm sure, exist in the government. And I am still on advisory groups, but our job is to look at the evidence and then tell the government what we think the evidence shows, or in the absence of evidence, the potential direction of travel. Now, whether the government accepts that advice or not is up to the government. I've worked with some state governments as well as with the center, and there is variability in whether advice is accepted or not.
When was the last meeting that one of these groups had, Doctor?
There's some on the other meeting, at least 2 or 3 times a week.
Okay.
So when was the last meeting? Possibly yesterday or the day before that.
Okay. And do you, in your opinion, and you could choose not to answer this question if you want to, in your opinion, do you believe that the decisions that are being made currently are based on scientific advice?
It depends on which decisions you talk about and which advisory committee. And there as well, it varies very much on which government is choosing to accept which piece of advice.
Central government, Dr. Kang?
Central government, I think, has many committees advising it. And some of the committees offer conflicting pieces of advice. Some of the experts have conflicts themselves. So how decisions are made at the center, I actually have no idea.
Thank you. Dr. Gagandeep Kang, thank you for giving us your time. I appreciate you making time for us, especially in the beginning of the third wave, as you said. We do hope, of course, that it is quick and sharp, and India, can see the fading of this third wave as quickly as possible. We appreciate the work that you and your colleagues have been doing for the last 3 years in battling COVID-19 in India. Thank you for speaking with us.